Hi everyone, my name is Dr. Jody and Athena, and today's topic is Stay Informed, your guide to sexual health. The purpose of this video is to provide a valuable resource to promote awareness and prevention of sexually transmitted infections, as well as to promote safe sexual practices. Firstly, what is a sexually transmitted infection or STI? Sexually transmitted infections, also known as sexually transmitted diseases, are a group of infections that are primarily spread through sexual contact. These infections can affect people of all ages and backgrounds and are caused by bacteria, viruses, or parasites. Sexually transmitted infections can range from mild, easily treatable conditions to more serious, long-lasting diseases. Here are some key points to understand about sexually transmitted infections. Sexually transmitted infections are typically transmitted through sexual activities involving the exchange of bodily fluids, such as vaginal, anal, or oral sex. They can also be transmitted through close skin-to-skin contact. Some sexually transmitted infections, like the virus that causes AIDS and hepatitis B and C, can also be transmitted through sharing needles or syringes for drug use, or through mother-to-child transmission during childbirth or breastfeeding. Let's now discuss factors that increase a person's risk of developing a sexually transmitted infection. Sexually transmitted infections can affect anyone who engages in sexual activity, regardless of age, gender, sexual orientation, or socioeconomic status. The risk of getting a sexually transmitted infection depends on various factors, including sexual behavior, the number of sexual partners, and the use of protective measures. Here are some factors that can increase the risk of contracting sexually transmitted infections. Multiple sexual partners. Having multiple sexual partners, or having sexual partners with multiple partners, increases the risk of encountering someone with a sexually transmitted infection. The more sexual partners someone has, the higher their potential exposure to a sexually transmitted infection. High-risk sexual activities. Certain sexual activities, such as anal or oral sex, can pose a higher risk of STI transmission compared to vaginal intercourse. These activities can lead to the exchange of bodily fluids and increase the risk of infection. History of STIs. Individuals who have previously had a sexually transmitted infection are at an increased risk of contracting another STI, as some sexually transmitted infections can make getting another infection easier. Young age. Young adults and adolescents are at a relatively higher risk of developing a sexually transmitted infection, as they may be more likely to engage in risky sexual behaviors and may not have had access to comprehensive sexual education. Inconsistent testing. Failure to undergo regular STI testing and screening can delay the detection and treatment of infections, potentially leading to complications and increased transmission risk. Drug and alcohol use. Substance use can impair judgment and decision-making, leading to riskier sexual behaviors and a higher likelihood of engaging in unprotected sex. For example, meeting an attractive new partner whilst at a nightclub and whilst under the influence of alcohol, taking a risk with unprotected sex with this person. Lack of education and awareness. Limited knowledge about STIs, prevention methods, and safe sexual practices can contribute to a higher risk of infection. Comprehensive sexual education can help individuals make informed decisions. Now that we know that anyone who engages in sexual practices may develop a sexually transmitted infection, how can we recognize it? What are symptoms that people should look out for? The symptoms of a sexually transmitted infection vary widely depending on the type of infection. Some sexually transmitted infections may not cause any noticeable symptoms, making them difficult to detect without testing. Others can cause symptoms such as genital sores, pain or burning during urination, unusual discharge, itching, rashes, fever, fatigue, and more. Untreated or inadequately treated sexually transmitted infections can lead to serious health complications. For example, some STIs can result in infertility, persistent genital infections called pelvic inflammatory disease, chronic lower abdominal pain, certain types of cancer, such as cervical cancer from untreated human papillomavirus, and an increased risk of human immunodeficiency virus spread that can worsen to AIDS. Sexually transmitted infections can also be spread from a pregnant woman to her baby if not treated early. Sexually transmitted infections are serious infections that can bring harm to you and those you love. Now that you know all about sexually transmitted infections, I am sure you may be thinking, how can I avoid it? The most effective way to prevent sexually transmitted infections is through safe sexual practices, including the consistent and correct use of condoms, limiting the number of sexual partners, and getting vaccinated against certain infections. Vaccines are available to help prevent getting cervical cancer due to human papillomavirus infection, as well as there are vaccines for hepatitis B. It's important to remember that contraceptive methods, such as the oral contraceptive pill, commonly called the pill, regular birth control injections from the clinic or a private doctor, or any other method that does not separate the skin of all parties involved in sexual intercourse, will not prevent a sexually transmitted infection. Those birth control methods only prevent pregnancy. A barrier method, such as a condom, is needed to protect individuals from sexually transmitted infections so that there is no exchange of body fluids. Regular testing for sexually transmitted infections is a vital component of sexual health. Good times to get tested include after risky sexual behavior as discussed earlier, or routinely when dating a new partner. Testing is often simple, quick, and confidential and can occur at a general practitioner, community clinic, or a gynecologist's office. Regular testing is good as early detection of infections can help to reduce the severity of these infections. One common test that should be performed in women who have had sex is the pap smear, which tests for the virus that causes cervical cancer. This test involves inserting a device to visualize the opening of the womb. Once the opening of the womb is seen, the healthcare provider will use a brush-like device to gather material from the area to test for the virus, human papillomavirus. If the virus is present, the healthcare provider will guide the patient accordingly. Otherwise, the patient should continue regular testing based on their age. Let's say that life happened, and a patient was diagnosed with a sexually transmitted infection. What treatments are available for these infections? Many sexually transmitted infections can be treated and cured with medications once taken as prescribed by their healthcare provider. However, some viral infections, such as the virus that causes AIDS and herpes virus, have no cure but can be managed with long-term medication. It is crucial to complete the prescribed treatment as directed by a healthcare professional and not stop medications just because the symptoms have gone away. Also, since the infection is caused by having sex, it is important to either not have sex whilst taking the medications or to use a condom. Also, encourage sexual partners to get tested. Otherwise, there is a risk of getting the same infection again. In the case of human immunodeficiency virus, the virus that can cause AIDS if left untreated, the importance of working closely with the doctor cannot be overemphasized. Patients with this virus will need to take medications for life, have regular blood tests, and practice safe sex based on how well controlled their disease is. Human immunodeficiency virus has had a bad reputation in the past. But with advances in medicine, patients living with this virus can live long, healthy lives once they stick to their medications, and can have sexually fulfilling relationships with their partner. Please see your physician if you would like to get tested for this or any other sexually transmitted infection, or would like more guidance on living a healthy and fulfilling life with human immunodeficiency virus. This has been a heavy topic, but here is the takeaway message. It's important to remember that anyone who is sexually active can potentially get sick with a sexually transmitted infection, regardless of age, gender, or sexual orientation. Regular checkups with healthcare providers to get tested, responsible sexual behavior, and communication with sexual partners are key elements in maintaining good sexual health and reducing the risk of STIs. I hope you liked this video and found it informative. If you did, please remember to like, subscribe, and share this video. If there is a topic you would like me to discuss, please leave a comment below. Thank you and have a wonderful day.